A colonoscopy is a specialized medical procedure that allows a doctor to inspect the colon and rectum for abnormalities. Conditions such as ulcers, inflammation, bleeding, polyps, and tumors can be identified and treated during this procedure. The process involves a device called a colonoscope, a long, thin, and flexible tube equipped with a high-definition video camera and a light source. This sophisticated instrument is inserted through the anus, passing through the rectum and into the colon. The colonoscope can sometimes extend into the terminal ileum, the final portion of the small intestine, to provide a more comprehensive examination. The video camera at the tip of the colonoscope sends live images to a monitor, enabling the doctor to examine the colon's inner lining in detail. The device also includes channels for air, water, and instruments, which are crucial for clearing debris, inflating the colon, and removing tissue samples or polyps. Just a quick reminder. We are not medical doctors. This video is for informational purposes only. How a colonoscopy works. The procedure typically lasts 30 to 60 minutes and is performed in a hospital or clinic by a trained specialist known as a gastroenterologist. Before the procedure, patients are usually given a sedative to relax and reduce discomfort. The patient lies on their side while the doctor carefully inserts the colonoscope through the rectum. The flexibility of the colonoscope allows it to navigate the curves of the colon. To help the scope move smoothly, the doctor might press gently on the patient's abdomen or request a change in position. Throughout the procedure, high-definition video footage is displayed on a screen, allowing the doctor to examine the colon meticulously. Images and videos may be recorded for further review or to document findings. During the procedure, air is often introduced into the colon to expand it, making it easier to inspect the walls. This inflation can sometimes cause mild bloating or cramping, but slow, deep breaths can help alleviate the discomfort. After the examination, the colonoscope is slowly withdrawn while the doctor continues to assess the colon's inner lining. Removal of polyps and biopsies. If polyps, small growths on the lining of the colon or other suspicious areas are detected, the doctor may remove them or take tissue samples for further analysis. Polyps are not always cancerous but can develop into cancer over time. Removing them is a preventive measure. One common technique for removing polyps is called a snare polypectomy. A thin wire loop is passed through the colonoscope to encircle the polyp. An electric current is then applied to cut off the polyp, which is retrieved for laboratory testing. This process is generally painless since the colon's lining lacks pain receptors. If you're finding this information helpful, please hit the like button, subscribe, and turn all notifications on to stay updated with our latest health and nutrition tips. After the procedure. Following a colonoscopy, patients are monitored in a recovery area until the sedative's effects wear off. Some may experience mild gas or cramping due to the air introduced during the procedure, but this usually resolves quickly. Because sedation can impair coordination and judgment, patients must arrange for someone to drive them home and avoid significant activities for the remainder of the day. The doctor typically shares initial findings after the procedure and discusses whether any follow-up care is needed. If biopsies were taken, the results might take a few days. Recognizing the early warning signs of colon cancer. Colon cancer is a prevalent form of cancer that often develops silently, with few or no symptoms in its early stages. However, recognizing the warning signs can lead to early detection, significantly improving treatment outcomes. Here are the most common symptoms to watch for. Changes in bowel habits. Persistent diarrhea, chronic constipation, or noticeable changes in stool shape or consistency. Example: unusually narrow stools can signal an obstruction or narrowing in the colon. If such changes last for more than a few weeks, consult a healthcare provider. Blood in stool. Blood may appear as bright red streaks or dark, tarry stools melena. While this could result from hemorrhoids or other benign conditions, it can also indicate a tumor in the colon. Any blood in the stool warrants prompt medical attention. Persistent abdominal pain or cramping. Ongoing bloating, gas, or stomach pain may indicate a tumor obstructing the digestive system. If these symptoms are frequent or severe, seek evaluation. Unexplained weight loss. Sudden unintended weight loss without dietary or lifestyle changes could indicate cancer. Tumors consume energy and may interfere with the body's ability to absorb nutrients. Fatigue and weakness. Colon cancer can cause chronic fatigue due to anemia from slow internal bleeding. This fatigue is different from normal tiredness and is often accompanied by dizziness or trouble concentrating. Feeling of incomplete bowel movements. Known as tenesmus, this sensation of needing to pass stool despite an empty bowel could result from a tumor blocking the rectum or lower colon. Chronic gas or bloating. Persistent bloating or trapped gas, especially when accompanied by other symptoms, might indicate a blockage in the digestive tract. Rectal bleeding or discharge. Bright red bleeding or unusual discharge from the rectum, even in the absence of bowel movements, should not be ignored. While colon cancer can affect anyone, certain factors increase the risk. Age. Risk increases significantly after age 50. Family history. A history of colon cancer or polyps in close relatives heightens risk. Diet. Diets high in red or processed meats and low in fiber are linked to a higher likelihood of developing colon cancer. Lifestyle. Smoking, excessive alcohol consumption, obesity, and inactivity contribute to increased risk. Medical conditions. Inflammatory bowel diseases such as Crohn's disease or ulcerative colitis are associated with greater risk. Prevention and the importance of early screening. Routine screening is the most effective way to prevent colon cancer or catch it early. A colonoscopy can detect and remove precancerous polyps, stopping them from progressing to cancer. For most people, screening should begin at age 45, but those with risk factors may need to start earlier. By staying vigilant for symptoms like changes in bowel habits, blood in stool, or unexplained weight loss, individuals can seek timely medical attention. Early detection dramatically improves treatment success rates, making regular screenings a vital part of healthcare. Colon cancer is a serious but preventable disease. By recognizing warning signs, understanding risk factors, and committing to regular screenings, you can protect your health and enhance your chances of early detection and successful treatment. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. It is always best to check with your doctor for medical advice and treatment. They will know more about your individual condition. Remember to check out our other videos on this channel. Thank you for tuning in. Until next time on Health Info Hub, stay informed, share your thoughts, and subscribe.